Hello, we are here today with Medic's occupational health consultant, Dr. Scarlet Spain, talking all about COVID-19 vaccinations. Hey, Dr. Spain.
Hi.
Hi, I wanted to dig in right away because I know you have some great information to share with us today. So to get us started, where are we currently at with vaccines and what types are in use?
Yeah, thanks for having me. Great question. So we currently have 2 vaccines here in the States that are authorized and recommended for use, which is the Pfizer-BioNTech COVID-19 vaccine and the Mrna's COVID-19 vaccine. We also have other exciting news that as of late December, there are 3 large-scale phase 3 clinical trials in process or being planned. So these 3 are AstraZeneca's COVID-19 vaccine, Janssen's COVID-19 vaccine, and Novavax's COVID-19 vaccine. So this is all really exciting news because this is obviously going to increase our access and speed and delivery to the public with these important vaccines.
Well, it's great to hear. Love hearing progress being made on this front. And with that in mind too, as we're pushing ahead and making progress, as of right now, how many COVID-19 vaccinations have actually been delivered?
Yeah, so from the data I saw earlier this week, it looks like here in the United States, we have delivered over 5 million doses and since we began vaccinating in mid-December. So we still obviously have quite a ways to go to reach those optimal numbers.
No, yeah, definitely a ways to go, but great to hear those numbers and see them steadily ticking up. And as we're thinking about this, I've been seeing news about the vaccines being administered out there and hearing more about them, but I feel like I don't have a total grasp on exactly how these vaccines work. So can you explain to us briefly exactly how the COVID-19 vaccinations, the vaccines have been working?
Sure. So the purpose of a vaccine is to provide an active acquired immunity to a particular infectious disease. So this should put protections in place to protect against that infection in the future. So both the Pfizer and Mrna vaccines for COVID-19 are mRNA vaccines. mRNA, or messenger RNA, is the substance in our body that contains genetic codes that the body can use to produce a protein. mRNA vaccines used in COVID-19 do not contain live virus or any parts of the virus. For these vaccines, they will essentially take a piece of genetic material that encodes the spike protein in the COVID-19 virus. Lipid nanoparticles will coat that mRNA, which is used to protect the mRNA so that it can get into the cells and produce that needed immune response. These vaccines are delivered in 2 separate doses and are injected into the upper arm. So after injection, the cells absorb the lipid coating surrounding the mRNA, and then the mRNA will then enter the cell and use the cell's translation to produce a viral spike protein. That spike protein will trigger the immunoresponse to produce antibodies and specialized T cells. So ideally, if a person is exposed to COVID-19 in the future, these antibodies and T cells will attack the virus, preventing the development of COVID-19.
Really interesting, and I'm glad you laid out that explanation for me because I hear words like nanoparticles and I start to get confused, but the real takeaway that I have from there is that it may be made differently and act a little bit different, but it's doing the same thing that I expect a vaccination of any other kind to be doing ultimately, and providing that protection, right?
Mm-hmm.
Okay, so we were talking about mRNA vaccines, and there's a lot of news out there, and it's kind of hard to keep track of. And we know what it's supposed to be doing. Can you tell us, have mRNA vaccines been shown to be safe in these trials so far?
Yeah, so at this time, mRNA vaccines have been shown to be safe and effective in the trials and in the groups that have received the vaccine so far. We did see a very small number of anaphylactic events with vaccine administration. So obviously, if you have a history of anaphylaxis or allergies or have had a previous vaccine reaction, you will want to discuss with your medical team this before obtaining the vaccine.
Got it. Yeah, that makes sense. And always want people to be, acting as safely as possible as we move forward with vaccinations. When I'm thinking about that too, we've got a chunk of the population that started receiving it, but obviously, like we said, a lot more to go ahead in this year. So, how will vaccines continue to be rolled out throughout the year?
Yeah, so to meet with supply and demand, the CDC is providing recommendations at the federal, state, and local governmental levels regarding these rollouts. So the recommendations on rollouts and essentially the levels of populations or groups that will receive the vaccine first, second, third, and so forth were aimed to decrease death and serious disease as much as possible, preserve functioning of society as a whole, and reduce the extra burden COVID-19 is having on certain groups of people are already facing disparities. So with the rollout itself, there have been groups designated. So right now we are in 1A, and this is healthcare personnel and residents of long-term care facilities. Then we have 1B. I do know some people in 1B are already getting access to the vaccines as well. This is going to be other frontline essential workers, people age 75 and older. And then we have 1C. So this is going to be people age 65 to 74, and then younger people with underlying medical conditions and other essential workers. And then essentially, as we see the vaccine availability increase, recommendations will expand to include more groups and populations, with the ultimate goal to be for everyone to easily get a COVID-19 vaccination as soon as available if desired.
Interesting. Okay, that's great to know too that there are differences. CDC has these recommendations, and then ultimately it falls to state and local authorities to really administer their own process around it. So paying attention to those local area plans is going to be big when figuring out where you might fall as far as the vaccination timing goes. And if I understand correctly, you actually fall into one of those designated groups to receive the vaccine. So have you gotten your vaccination yet?
Yes, I received my first dose probably about a week and a half ago. The process was great, very, very smooth. No issues besides my arm was a little bit sore the next day.
Well, it's great to hear it. Not about the sore arm. Sorry you had to endure that. But otherwise, yeah, it's sounding like you're doing great. Okay, well, you've shared a lot of great information with us today about, the nature of this vaccine, how the rollout is going, and sharing your own experience, which I appreciate. But, if people watching today want to learn more, what should they do to educate themselves about the COVID-19 vaccine?
Yeah, so that's another great question. I would definitely recommend searching reputable sources, such as the CDC is always going to be a great source. Also speak with your personal healthcare team about your own personal health and any underlying medical conditions that you have as those vaccine rollouts begin to start. So really educate yourself. Well,
that's fantastic advice. And, I'm thankful that we have our own reputable source of information here to join us on videos like this, and also to share more information on our website. So if you are interested in learning more and hearing more from Dr. Scarlet Spain, you can see more of her work on medicsteam.com. In our blog under the industry expertise section, as well as some other videos that she's published on these subjects before. And you can also check out our very own COVID-19 vaccine page for more details. So before we close here, I just wanted to thank you again, Dr. Scarlet Spain, for taking time out of your day to join me and to share a little bit about the COVID-19 vaccine.
Yeah, thanks for having me.